In the absence of a robust national communication strategy for vaccine administration and distribution, there are still a few communications considerations that we want to make sure providers are thinking about in the weeks and months ahead. First of all, you might feel like you're going it alone because of the lack of the national strategy, but there's still an opportunity to coordinate with other provider organizations. Sometimes those are organizations that have traditionally been competitors, but in this COVID reality, there's an opportunity to streamline communications and make sure that there is communications consistency among your organizations. As Dr. Roger Ray from Chartis recently pointed out, there's also an opportunity for many organizations to work with providers across state lines when they have markets that border different states. Another communications consideration, as you're speaking about the safety and the efficacy of the vaccine, the FDA is truly the authority in the country that has had the chance to review data from the pharmaceutical companies to vouch for the safety of the vaccine. It's not essential, and it's not even recommended, that you or your providers take responsibility for the safety. We all believe in the vaccine. We all want our patients and communities to be vaccinated. But because the FDA is the authority that's reviewed the data from the pharmaceutical companies, cite the FDA, cite their process. Use that as a way to give confidence to your team members and also your community about the safety of the vaccine. And then third, focus on what you can control. There are so many things that are flying at provider organizations right now, but what you do control is the distribution and the administration of the vaccine. Share with your team members process updates on how that's going. Share that with your community and your patients as well. Use that as a platform to create confidence for the work of your team members. And I'll say, if you don't tell your story, others will tell your story for you. It's much better to lean into this message, to take the voice of authority role, and to build confidence both with your employees and with your patients about the safety and the efficacy of the vaccine.